My name is Cameron Searle, and the first test I'm going to be doing is the POTS compression test. So we're going to suspect there's a fracture right here. So for the compression test, I'm going to push together, I'm going to compress the tibia and fibular with my hands being flat. So I'm going to push, and if there's no pain, then I'm going to go towards the fracture site. Now if there's pain while compressed, that means it's a positive test, which is indicative of a fracture.
Hi, my name is Cameron Beans, and for the second test, this will be my first one, we're going to conduct the long bone compression test. So for this test, we're pretty much looking for a fracture. In this case, it'll be in one of his 5 metatarsals. For this one, we're going to look at the 5th metatarsal to make it easier to view. So on here, I'm going to grab the head of the 5th metatarsal, which should be around here. And then I'm going to grab the base, which should be down in here. Now what I'm going to do is I'm going to compress axially on it. And then this should indicate if there's any pain, then that would be a sign for a positive test, but in this situation, it'll be negative.
My name is Nicole Ardetta, and I'll be performing the vibration test. You'll need a tuning fork for this test. This is my tuning fork. When conducting this test, you'll want to have the patient feel the vibration on their uninvolved side. So I'll go ahead and strike the tuning fork, and then place it on a long bone on the unaffected side so they know what it feels like. I'll then go to the involved side, and if the suspected fracture is on the 5th metatarsal, I'll want to place the tuning fork away from the suspected fracture site. So I'll go ahead and strike the tuning fork, place the tuning fork away from the fracture but on the same bone. A positive test is if they feel pain at the suspected fracture site. That's a vibration test.
So for my second test, I'm going to perform the percussion test. In this situation, I'm going to be, we're actually looking for a fracture as well for the tibia. So in this situation, what I'm going to do is I'm going to grab her on the metatarsal up here. Now I'm going to hit her on her calcaneus or her heel. I'm going to hit it a couple times firmly. And in this situation, if she has any pain in her tibia, that would be a positive test. If not, it's a negative test. So.
This next test is the Ottawa foot rules, and for this test I'll have my patient stand up, and we're trying to determine if they can bear weight for 4 steps. So I'll take 4 steps. If the patient cannot bear weight, then you would recommend further imaging or it'd be a possible fracture in the foot.
I'm Alex Searle. This is the Ottawa ankle test. Same thing, I'm going to have my patient take 4 steps. If the patient cannot bear weight and the pain is within 6 centimeters of the ankle, then that is suggestive of a positive test, may be a fracture, and likely needs to go get it x-rayed.
This next test I'll be performing is the anterior drawer test. So I'll have my patient sit on the table with their legs hanging off. So I'm going to scoot forward. This test is testing for pathology in the anterior talofibular ligament and the tibiofibular ligament. So I will grab the distal part of the shank and then grab the calcaneus and apply an anterior force to the calcaneus. You're testing for laxity in those ligaments, and you would want to perform this test bilaterally to determine if there's pathology in the affected side.
This is the Taylor tilt test. Once again, we're going to be testing for laxity. So what I'm going to do is I'm going to grab the uninjured leg first, and I'm going to, with one hand, I'm going to stabilize the shaft. With the other hand, I'm going to grab the heel, and then I'm going to invert and evert the foot passively, feeling for that laxity or that looseness. And then I'm going to test it bilaterally on the other side. And any laxity when comparing bilaterally would be a positive test and would be indicative of a potential injury to the deltoid ligament for eversion and the calcaneofibular ligament for inversion.
The second test I'll be doing is the dorsiflexion maneuver test. So what we'll do is I'll have the patient slide back, and I'm going to passively move their foot into dorsiflexion. If there's pain over the syndesmosis, then it's going to be a positive test, and we're looking for a high ankle sprain.
This is the Klieger test, and we are testing for damage to the deltoid ligament. A positive test would be pain. So I am going to grab the injured leg and I'm going to stabilize the shaft with one hand. With the other hand, I'm going to grab the bottom of the foot, and then I'm going to passively externally rotate the foot. And any pain in this motion would be suggestive that there is a potential injury to the deltoid ligaments.
The next test is going to be the squeeze test of the leg, and we're looking for a high ankle sprain. A positive test would be pain over the syndesmosis. So I'll have the patient sit back on the table, and I'm just going to compress the malleolar line like this. And then if there's pain, it's a positive test.
For my third and final test, I'm going to be conducting the Thompson test, which is going to be looking for an Achilles rupture. I'm going to have the patient lie on her stomach, please. Now I'm going to compare these bilaterally. So first off, we're going to look, what I'm going to do is actually I'm going to grab the gastroc, one of my hands, I'm going to squeeze it, and right here we're actually looking for the foot to go into plantar flexion because the Achilles rupture, or Achilles tendon is connected to the calcaneus, or the calcaneus tendon is connected to the gastrocnemius, sorry. And then we're going to be looking for the same thing on this side as well. Now based off this test, her Achilles seems to have not ruptured, so that would be negative.
This final test is called the Maddles test. I'm going to have my patient lie on her stomach again, and then she is going to bring her legs up in knee flexion, both of them, and then we're going to look at the feet as they are just natural. If one of her legs had ruptured an Achilles tendon, then that foot would in this case droop down more and be more in dorsiflexion than the other foot would be. In this case, both of her feet are pretty equal. That's suggestive of a negative test, and she has both of her Achilles tendons.